Adverse Event Reporting in SWOG Clinical Trials. For this Adverse Event Reporting Guide, we will touch on a few topics including definitions and background, information in SWOG protocols, referring to where to find AE information in specific sections of the protocol. Example, Section 3, which expresses drug information and AEs associated with the drug. How to report adverse events via the CTCAE, grading, attribution, and status. And lastly, we will discuss online data submission for adverse events in our legacy trials on the CRA Workbench and in RAVE. Let's start with some definitions. An adverse event is any change in a patient's condition from the beginning of protocol treatment, regardless of cause. An adverse event can be anything from nausea caused by treatment, to seasonal allergies, to breaking a leg, to increasing cancer symptoms. You indicate how each of these adverse events are related to treatment by assigning an attribution code. I will talk more about attribution codes in the latter part of this presentation. The terms toxicity and adverse event are used almost interchangeably throughout the protocol. Toxicity is defined as adverse symptoms caused or possibly caused by drugs or treatment used in the study. From the table on this slide, you can see examples of some toxicities that arise due to chemotherapeutic agent that targets rapidly dividing cells, such as those found in the bone marrow, mucous membranes, and hair follicles. Although some areas of the protocol may say toxicity, we are collecting all adverse events unless otherwise specified. Sometimes a patient will experience an unexpected or severe reaction to protocol treatment. These adverse drug reactions are called serious adverse events. SIEs are reported to the NCI via the CTEP-AIRS system. Details about when or whether to submit SIE report is always found in Section 16 of SWOG protocols. Expedited reporting can be done through CTEP-AIRS. For more details, please refer to the module regarding SIE reporting. For this module, we want to focus on routine reporting, which refers to all adverse events regardless of attribution or grade, unless otherwise specified on the forms or protocol. But remember, if you have reported an SAE through CTEP-AIRS, you still need to document the same event on the study-specific adverse event forms. Be sure the grade and attribution match the SAE documents. Why do we collect routine AEs? Every trial has an objective regarding adverse events. We always want to consider the safety of our experimental regimens as well as effectiveness. For instance, in Phase 1 trials, the primary objective would be to assess the safety of an experimental regimen and determine the maximum tolerated dose. In our Phase 2 single-arm trials, a secondary objective may be to estimate the frequency and severity of toxicities in the trial regimen. In Phase 3 randomized trials, a secondary objective would be to compare the frequency and severity of toxicities associated with each regimen. Now we will dive into a SWOG protocol to see where adverse event information can be found. Protocols are always your first and best reference. All SWOG protocols are set up the same. There are 5 sections in active protocols that contain information about adverse events. Section 3 talks about known human toxicities and drug supply information. Section 8 talks about toxicities to watch for, dose changes during treatment in response to various AEs, dose modification tables, and names for physicians to call for assistance. Section 9 talks about schedules and how often to assess AEs. Section 14 talks about how often to submit AE forms, which should line up with the study calendar, unless otherwise specified. Generally, these forms are submitted once per cycle or each reporting period. Section 16 talks about instructions for SAEs. And lastly, there is a master form set, which is located on the SWOG or CTSU protocol page, containing paper versions of the forms, including AE collection forms. This is useful because it lists the common expected AEs by CTCAE term. Section 3 is the drug information section. This section lists human toxicities that are already known to be caused by the agents used on the study. This section is also your resource for information regarding drug supply. Much of the time, one or more of the agents specified is commercially available and not supplied for the study. But just as often, one or more of the agents is provided specifically for the research, so this is where you look to know whether or not you need to do anything special to get the drug. Section 8 is the toxicities to be monitored and dosage modification section. Like Section 3, it also lists certain toxicities to watch for. Section 8 will always tell you which version of the AE criteria is being used for that study and where to access it online. The online AE program will only allow you to enter and grade toxicities per the specified version. In addition, this section details dosage changes that are required during treatment should a patient experience an adverse event. These required changes are sometimes displayed in a dosage modification table. Here is a very abbreviated example. In this table, the different dose levels are listed above and the possible adverse events are listed below. Usually more than one type of adverse event is listed. However, remember this is a very abbreviated example. These grades refer to the severity of an adverse event, and you should always use the highest grade that was experienced during a treatment cycle. In this example, for grade 1 or 2, there is no change in the dose level. For grade 3 or 4, the dose is decreased 1 level. Thus, if the patient's lowest platelet count was a grade 3 after receiving the 100 mg over m squared dose, the next dose would be decreased 1 level to 75 mg over m squared. Any questions about treatment or dosage modification must be directed to the physicians responsible for the study. You can find dose modification contacts usually at the end of Section 8 with their email and/or phone numbers. In addition, you can find phone numbers of the study coordinators and their backups in Section 7 or on the title page of the protocol. If Section 8 dose reduction instructions are not followed, the patient may receive too much protocol treatment. Not only would that be bad for the patient, but it could also skew the toxicity picture for the protocol. Some protocols instruct you to increase the dose again after toxicities have cleared. If dose escalation instructions are not followed, the patient may be given too little protocol treatment and the treatment may not appear effective or may seem less toxic than it truly is. As a result, it is extremely important to follow the dose reduction and/or escalation instructions. Section 9 of a SWOG protocol is the study calendar. The study calendar lists important events that occur on the study. It is intended to be used as a quick reference and scheduling guide, but is not the main resource for study adherence. For example, for data submission requirements, you will always look in Section 14. If you want to know what is required for disease assessments, go to Section 10. A typical calendar contains the protocol treatment schedule, specific labs to be done, a schedule for disease assessments, and will also indicate how often you should assess for adverse events. Because some treatments can cause long-term or delayed effects, some protocols may require you to continue to assess toxicities even after the protocol treatment is finished. Ongoing toxicities that were already reported during treatment should only be listed on the follow-up form if they increase in grade. Late effect toxicities that have not previously been reported should be included in the follow-up form once the patient is off study treatment. Section 16 addresses ethical and regulatory considerations. This section contains instructions for reporting serious adverse events. As I mentioned earlier, please refer to the Serious Adverse Events module for more detail. The master forms packet for open protocols are located on the protocol abstract page, which is accessed through swog.org, clinical trials, then choose open protocols and type in the study you are looking for. Forms for inactive protocols may still be found in Section 18 of the protocol. Although all data is submitted online, paper forms are still available if you would like to use them as a worksheet. All new protocols open in Rave. However, active protocols currently using the SWOG data submission program will continue to use it until they are closed to follow-up. While data submission procedures may have changed with Rave, adverse event assessment and reporting has not changed. Now that you know what toxicities and adverse events are and where to find information on how to monitor them, I'll talk about how you should report these events to us at SWOG. First, I'll discuss the criteria. CTEP, the Cancer Therapy Evaluation Program, provides the criteria that we use to grade adverse events. Version 3 was developed for studies after October 2003. Version 4 is used for all protocols activated after October 2009. Currently, version 5 is the latest version of the CTCAE and is used in all protocols activated after 2018. Most open protocols use version 4, however, make sure to double check the protocol. Section 8.1 will specify and provide a link to the CTEP website with the appropriate version. As mentioned in the previous slide, CTEP released version 4 of the CTCAE in 2009. Studies that have been open after 2018 are now using CTCAE version 5, so make sure to verify in the protocol which specific version you'll be using. The online program you currently use to report adverse events remains the same, but you will notice some codes are now more comprehensive. You can obtain more criteria information from the website shown on this slide, ctep.cancer.gov, and you can also download your own copies of the criteria from this site. This is the first page of the CTCAE version 4.03. These are organized alphabetically in their own category. The system organ class we are looking at is blood and lymphatic system disorders. You can see the adverse event term, for example, anemia or bone marrow hypocellular, and you can also find the definitions provided for each term. Each grade is from 1 to 5, and you can see the clinical description of that adverse event for each grade. Sometimes the CTCAE term might not always be listed the way you would expect. Some examples of this include thrombocytopenia, which would actually be platelet count decreased, neutropenia, which would be listed as neutrophil count decreased, lastly, pneumonia, which would be listed as lung infection. You also might notice that rarely you will not be able to find a CTCAE term that best describes an AE experienced by the patient. Each category includes an other option, for example, investigations other. Please only use this option as a last resort and make sure to verify if there is a similar AE term that could be used instead. Grades refer to the severity of the AE. This is the general grading criteria. However, as we saw in the previous example, there are specific descriptions of grades for each AE. Also, not all grades apply to all AEs. If we go back to our previous example, you can see grade 5 is always death. As mentioned before, the chart shows specific descriptions of grades, some lab-based, some more clinical. Please note, not all AEs have all grades. Febrile neutropenia is a good example. If patient meets criteria, they are automatically at least a grade 3. There are also terms such as palpitations, ear pain, alopecia, etc. that only have lower grades. When in doubt, refer to your CTCAE guidelines. Don't expect to just grade based on mild, moderate, severe, etc. In addition to grading adverse events, SWOG studies require an attribution code. An attribution code is a description of the relationship of the adverse event to the protocol treatment. Attribution codes range from 1 for unrelated to 5 for definitely related. Depending on how data is collected, you may enter the number or the word. For RAVE studies, you select the word from the drop-down menu. Please note that the attribution codes must be assigned by the physician, not the patient or CRA. Some studies collect status codes in addition to grade and attribution. These are monitored by CTEP's Clinical Data Update System, or CDUS, and are collected in studies called Complete Reporting Studies. If the study uses a baseline abnormalities form, it is a complete reporting study, and status will be collected on the AE form. Status is the state of the adverse event at various points throughout the study. The status can be new, if this is the first occurrence of the event on study, or a previously reported AE that may continue at the same or a lower grade, or a previously reported AE that may have worsened or improved and then worsened again. Here are the general rules for AE reporting. Number 1. Record events as they occur. Don't wait until the protocol treatment has been completed and then attempt to remember what the patient reported. Number 2. Pre-study symptoms or abnormal lab values should not be recorded as AEs unless they worsen following treatment. Some studies require a baseline abnormalities form to be submitted to assist you with keeping track of conditions existing prior to treatment. And if there are overlapping AEs like pulmonary edema and dyspnea, record and grade them both. Number 3. Record the most severe grade experienced since the patient was last assessed. Number 4. Please avoid using other adverse event codes whenever possible. These are adverse events that appear in the criteria such as pain other or metabolic other. If you can find a term in the criteria that more accurately describes the adverse event, please use that term instead. It may also help to use the category lookup in these cases to find a better match. However, if the adverse event is not listed elsewhere in the criteria, please document it by using these other AE codes and add a comment to specify, such as metabolic other BUN. Number 5. If you are unsure, document them. Forms can be amended. Now, I will discuss how to document AEs using the online data submission portals for our legacy trials and RAVE. But first, we will talk about our legacy trials. This slide is a screenshot of the online data submission page for a particular patient from one of our legacy trials, S1117. You will only use this portal for protocols that opened before April 2012. To get here, click on the data submission link on the CRA workbench and then insert the appropriate study number and patient ID number. This will lead you to this screenshot, which you will click on the Forms tab and then select the On Treatment tab. For this module in particular, we are focusing on the Adverse Events form, and you will click on that link. Part 1 of this form requires you to fill in these fields. If adverse events were not assessed during this time period, you must fill in a comment explaining why before this program will allow you to continue. Some studies may only collect certain grades of AEs, so be sure you know what are considered reportable events for each protocol because it won't always be the same. If you chose yes and reportable events occurred, you will then continue on to Part 2 of the form. In Part 2, you will look up the adverse event by keyword or by browsing through the CTC categories. If you are having trouble finding the adverse event in the lookup area, check and make sure your spelling is correct. Remember, the online program will always use the correct version of the CTC criteria for your patient study. When you look up a keyword, a list of all the adverse events matching that keyword will appear in a pop-up window. Please note, if you cannot see the page, it is essential for you to disable the pop-up blocker on your web browser in order for this form to function as designed. When the new window appears, you can pick your particular AE from those listed. As you see, there are several matches for the term rash. You may need to check with the patient's MD to see which is the appropriate code to use. For this example, we will use rash desquamation. Once you have chosen your AE, you will then be prompted to choose the grade and attribution codes from the drop-down boxes. If the study uses status codes, a drop-down box for the status code will also be present. A great feature of this program is that it will only allow you to choose from the grades allowed for your particular AE and criteria version. As mentioned earlier, some AEs only have a few possible grades, so this reduces your chances of making a mistake. Also, if you would like to see the grade definitions for that particular AE, you may click on the Display Grades Definitions link. When you have completed the fields, click the Add button. Now that you have added your adverse event, it will appear like this. Another great feature of this program is that you can amend your AE data online at any time. For example, after you added this rash AE, you realize that you meant to enter the attribution code as 2. You simply click on the blue rash desquamation link, and the program then allows you to amend the AE information. You can then change the grade, attribution, status codes, comments, or delete the AE altogether. If you are having trouble, remember to unblock the pop-ups. Or, say you already submitted an AE form for a particular reporting period and you want to go back and amend it. First, you'd go to the data submission section and open the tab where the AE forms are located. You'll see the plus sign if some reporting periods have already been submitted. Click on that. It will show the reporting periods you've entered already. Click on the one you want to amend. Then click on the Edit button and you can make any changes you like. Now we will discuss online data submission for adverse events in RAVE. This is a screenshot of what the adverse events form looks like in RAVE, which is very similar to the one we discussed earlier on the CRA workbench. If you answer yes to the question, were adverse events assessed during this time period, there is a sub-question that asks you if the patient experienced any reportable adverse events during this reporting period. Please note, reportable does not mean only SAEs or AEs requiring expedited reporting. For most studies, you would typically answer yes to this question and document AEs that are either new, increasing, worsening grade, or if an AE stopped and recurred again in a future cycle. Typically, if an AE has been continuous without any changes, you would not need to report these events again unless otherwise noted in the protocol. For this module in particular, we are going to answer yes to this question. Once you save the form with the appropriate data entered into the chart, you'll see the adverse events report form populate into the folder. This is where you can insert the reportable adverse events that occurred during the reporting period. This is a screenshot of what the adverse events report page looks like. Here you will choose from the drop-down menu under each column and select the appropriate information for the patient. You can type into the field in order to find the term you are looking for, but be sure to select from the drop-down menu at the end. If you type the term in, for instance pneumonia, instead of selecting lung infection from the drop-down menu, you will get a non-conformant data error message expressing that this information provided is in an invalid format. In the rare instances that you cannot find the CTCAE term you are looking for, you can select the Other category, which prompts you to specify what the other option is. In the example in this slide, you can see the Other category is referring to LDH increase, which is not mentioned in the CTCAE. As mentioned before, please select everything from the drop-down list, including grade. In this example, I typed in 1 instead of selecting the grade from the drop-down menu. There is no CTCAE grade 1 for lung infection, so there is a non-conformant data error message on this log line. This is why we strongly encourage you to select from the drop-down menu, or else the system will require you to change it. Now select the attribution code and, if applicable, the status code from the drop-down options. Finally, select yes or no to hospitalization. This is something we haven't discussed yet. The instructions at the top of the form explain only select this option if the adverse event resulted in inpatient hospitalization or if the patient was already in the hospital. The adverse event prolonged the inpatient stay by at least 24 hours. Once everything is complete, hit save. Once you hit save, your form should look like the screenshot in the slide, clean without any non-conformant data error messages. To add the next AE to the list, you will also need to use the Add a New Log Line link. You can also select the Inactivate option to inactivate any AEs that you've entered in error. You can always edit a log line as well by selecting the pencil icon to the right. For example, say I realized I made a mistake and meant to select hypocalcemia instead of hypercalcemia. By selecting the pencil icon, I can select the correct term from the drop-down menu. However, note that when I change the term, the grade will clear out. If I save the form as is, I will get an error. So be sure to select a new grade from the drop-down menu as well. This is the new AE form mandated by the NCI for studies that use investigational new drugs. S1505 is the first new study to incorporate this form. In theory, this will be implemented with all new SWOG IND studies moving forward. As you can see, there is a lot more detail being collected, but the purpose of this design is to incorporate the SAE reporting into the regular adverse event form. If the event and grade entered on your routine reporting match up with an SAE for the study, you will be prompted for more data about the event, which will replace the need for separate CTEP errors reporting. In conclusion, please feel free to email us at the SWOG Data Operations Center in Seattle with any further questions or concerns. These distribution lists put you in touch with the assigned data coordinator as well as their backups if they are unavailable. Thank you for listening. You have just completed the Adverse Events Reporting module. Please feel free to refer to the ORP manual for further questions as well.